Hi, I'm Sophie. I'm a pharmacist and the patient education manager at EUFOREA. Good inhaling technique is essential because it helps the medicines reach deep into your lungs, where it helps control your symptoms. It might take a few tries to get the hang of it, but with a little practice, it will get easier and more natural. Some inhalers have medicines that help open up your airways. These are called bronchodilators. They make it easier for you to breathe. Others contain medicines that reduce the inflammation in your lungs, and these are called steroids. Some inhalers contain a combination of both.
You will receive a pack that contains an empty inhaler and a cartridge that you will need to insert. For refills, you'll usually only get a new cartridge. However, the inhaler itself should be replaced every 6 months. The first time you use the soft mist inhaler, you will need to insert the cartridge. Keep the cap on the mouthpiece closed. Press the safety catch on the side of the inhaler and pull off the clear plastic base. Mark on the inhaler on the checkbox that you have used a new cartridge. Insert that new cartridge into the inhaler and click it into place by pressing the inhaler against a firm surface or tabletop to be sure it has gone in all the way. You will hear a click. Put the clear base back into place. You will hear a click again. Now you need to prime your inhaler. Hold the inhaler upright with the cap closed. Turn the base in the direction of the arrows until it clicks. Open the cap, point the inhaler towards the floor away from you, and press the dose release button on the side. Check to see if a mist comes out. Close the cap. Once you see a mist, repeat the priming steps 3 more times. Your inhaler is now ready for daily use. If you have not used your inhaler for 1 to 3 weeks, repeat the priming steps once to release 1 spray. If you have not used your inhaler for over 3 weeks, you will need to repeat the priming steps as if you are starting the priming steps from scratch. Now your inhaler is ready to use. Let's go through the steps for daily administration. Step 1. Check the dose indicator to see if there is still medicine left. Step 2. Hold the inhaler upright with the cap closed. Turn the base in the direction of the arrows until you hear a click. Remember to only turn the base when the cap is closed, otherwise your dose might be lost. Open the cap by pushing on the small round opening tab. Step 3. Hold the inhaler horizontally. Check that there is nothing inside the mouthpiece. Step 4. Sit or stand upright, slightly tilting your chin up so that you're pointing the inhaler towards the back of your throat. Step 5. Breathe out slowly and fully away from the inhaler. Step 6. Put your lips around the mouthpiece and close your lips tightly around it without blocking the air vents on the sides. Step 7. Start to breathe in slowly and steadily, and at the same time press the dose release button on the side to inhale the mist. Take the mouthpiece out of your mouth with your lips closed and hold your breath for up to 10 seconds or for as long as you comfortably can. Step 8. Breathe out gently away from the inhaler. Step 9. Wait 30 seconds and repeat for a second puff. Don't forget to close the cap before you turn the base. Step 10. Close the cap on the inhaler. You should clean your inhaler once a week. To do this, use a tissue to wipe the inside and the outside of the mouthpiece. When your cartridge is empty, the dose counter will turn red and show a down arrow. As you turn the clear base, it will loosen and the inhaler is in a locked position. Pull the empty cartridge from the inhaler and repeat the steps to install a new cartridge. After using 6 cartridges with your inhaler, it's time to replace the inhaler device with a new one.